Okay, guys, you're here today with the two most handsome guys talking about health insurance on the internet.
As far as I'm concerned.
According to us,
According
right,
to us, yeah, absolutely.
Co-working space here in the capital city of Jefferson, right in the heart of Missouri.
You're seeing us live.
Yeah. And today we're talking about health insurance. I hear a lot of talk. There's a lot of buzz around this free preventative. So we're going to talk on that today. We're going to speak to those points, and we're going to actually debunk the myth of free preventative health care. What are the pitfalls? I'm going to hand it over to the expert, Tom. He's been in the space for nearly 2 decades. I'm just going to round up a
Pretty
little
close,
bit.
yeah.
Call it 20 years
yeah.
now. So why don't you take it over? Let's talk about it.
Absolutely. So since 2010, the legacy carriers have had to cover preventative care at 100% with no deductible. Alira does the same on the preventative care. Covers, the preventative care at 100%. One of the problems that we've had with that free preventative care is with the colonoscopy, both with men and women.
Okay.
Whenever you schedule your appointment to have your colonoscopy done, you're obviously scheduling that because it's a preventative visit. You're wanting to make sure that nothing's wrong. You're not sick, you're not hurt, you're going into this total expectation of just finding out if I have a good colonoscopy exam or a bad one. Mm-hmm. So it all comes down to medical coding and billing.
Okay.
In the middle of this colonoscopy, if they find and remove any polyps, that bill or service that is going to be sent from the provider to the insurance company is no longer now going to be coded as a preventative service. It is going to be billed as any other normal outpatient procedure, which is going to be subject to your deductible. Mm-hmm. So a lot of people have been going in with full expectation that their colonoscopy would be covered at 100%. And because a polyp was found and removed and they changed the medical billing and coding, they are now receiving a bill for $1,800 plus for that service because it's subject to their deductible. So people are not aware of this, to be quite honest, until they get the bill in the mail.
Sure.
And then they call their agent, and their agent does some investigation and finds out that, yes, this was, with all intents and purposes, when you went into it, going to be preventative care. But because of how medical billing and coding works, they found that polyp and removed it. It's no longer a preventative care service. It is going to be billed as a normal outpatient service, which is going to be subject to your deductible, and you're probably going to have to pay the full cost of that.
And for most people, the deductibles that we're used to seeing with people, they're going to have to absorb that entire amount before they even come close to capping out on a deductible or a max out of pocket. And for those of you that want to know all about copays, deductibles, and max out of pockets, check us out on the other video we just shot last week. We dive deep into that. We answer all your questions regarding those. Absolutely.
But I think that that's something that we should talk about and should be mentioned more, because most people are going out there and getting these things done and getting a bill. I mean, that's just a real shocker, and definitely an unexpected, $2,000 bill is not something any of us want. And so I think the more people are educated on exactly how their benefits work, they can be better guarded against, what's going to happen for them and what they're going to be charged and so forth. But people need to know that, you can go into a colonoscopy with it being fully considered a preventative service and come out of that colonoscopy with it not being considered or billed a preventative service. It's going to be billed a normal procedure code, which means it's not going to be paid by the insurance company at 100%. You're going to be paying $1,800.
Yeah, I can see how that would be a real shock to a lot of people.
That is, and especially as an agent, when you're out there talking to people about the benefits available to them, and you're explaining to them, oh my, yes, have that colonoscopy done. That's a really bad day for a lot of people.
Well, you hear it so often. People say, you got to get that colonoscopy. It's such a preventative thing, but it can get bad if you neglect it.
Absolutely.
So go ahead and get it done. You hear about all this free preventative.
Preventative. Those free preventative services can turn into regular medical services which do not have the preventative billing code, which means they are not going to be paid at 100%.
Yeah, right. I see that. So for the people that they're not interested in shelling out thousands of dollars before the insurance helps them out. I mean, we're paying such high premiums, I mean, it's ridiculous. And then you go in and you're paying entirely out of pocket for these types of procedures to be done. What are the options for those people? Is there anything else that they might want to look at? Any workarounds that you can think of?
I really don't. I just, from an insurance agent standpoint or an insurance advocate, advisor, I just now am making sure every person I talk to about these preventative care services, I am mentioning that this is a potential pitfall or downfall.
And with the Alira, if somebody doesn't have traditional health insurance, if somebody does carry Alira, are they going to pay?
It's going to be the exact same situation, unfortunately.
Okay.
Because, Alira is going to use PHCS, Private Healthcare Systems, as their nationwide network. And the procedure codes are going to be the same. It's just the way, the way the providers operate, and then the insurance companies pay according to the information they receive. Your provider is not going to remove a polyp and then just send it all in as preventative care. That's just not how it works. So I don't really have a workaround for that. That is definitely, a good point. I mean, I
know that a lot of times Alira, we've talked about on some of the other videos we've done, a lot of times they'll chip in, you don't have an entire deductible to meet, and they'll go ahead and help out right off the bat. I mean, as soon as you enroll, they'll start helping, right?
Correct.
In a lot of situations.
On your copay benefits, medication, preventative care. But that's just an unfortunate pitfall of the colonoscopy underneath the preventative care portion. Is if they find a polyp, they're going to change that billing procedure code, and it's not going to be preventative, and you're going to have to pay it, whether you have a legacy plan or you have Alira.
Okay.
Yeah.
Well, thanks a lot for clearing that up, Tom. I know that helped a lot of people out. I had no idea.
Yeah.
So this is one big thing to think about before you go in there for that colonoscopy.
Absolutely. Just be prepared. I mean, you obviously want to have it. I'm not trying to tell anyone not to do it. I'm just saying that you need to understand how your benefits work, and that, there is the potential that this colonoscopy you're having done is not going to be paid at 100% because there was a polyp or two removed, and now you're into a different procedure code.
Yeah, sure. That's clear, crystal clear. Well, thanks guys for hanging out with us today. We're fighting for excellence in healthcare, and we want to empower you with the knowledge for you to take control of your health and your future. Come check us out at healthinsuranceThinkTank.com. And until the next video, you guys take care. Goodbye.
Have a good day.